Global Health Ministries. And I just want to, I've never met you personally. Kelly, how long have you been with the organization?
I started last February, right before COVID hit.
Okay.
So,
Oh, well,
yeah.
well, what a great time to start.
There you go.
Yeah. I have a long association with Global Health Ministries because when we were talking about starting Lutheran Partners in Global Ministry, GHM was already going, had been going for maybe 5 or more years. And I remember meeting with the director there, Ken Grosh. I met with Ken several times, and he gave me lots of good information about how to start an organization and so on. So that was really key to some of my thoughts in starting Lutheran Partners. And then, after working with Ken for a while, Tim Iverson came along as executive director, and we worked a lot together. We worked in, actually our paths crossed in India, but mostly in the Central African Republic, where we worked together on building a hospital. And I remember just meeting with Tim many times on that. In fact, he ended up then going with me to the Central African Republic for the dedication of that hospital. And so we learned to know each other very well. The other program that you're working on, GHM has been working on, is the program in South Sudan, right? The medical program there. So that is, Bethel has given quite a bit of money to that program now, South Sudan, because the Southeast Minnesota Synod has joined forces here with the LCA and others to support that program in South Sudan. So we've had a direct link with that as well. I met Doug Cox in Madagascar when he was first starting there as a missionary, and that was many years ago. And then since that time, he came back here and became an associate pastor at Mount Calvary Lutheran in Excelsior, where Judy Tonoli was a member for many years. And Judy, while she was there, was a partner with us at Lutheran Partners in doing many things and traveling with us and so on. So she became a very important link for us at Mount Calvary. I'm really impressed with the work that the Global Health Ministries does and have been for a long time. It's a huge organization. They have a warehouse that stores medical supplies and sends them all over the world. They use a lot of, or they have in the past used a lot of volunteers. It's a terrific organization, Lutheran based, although they work with non-Lutherans as well. I will let Kelly give more information on all of this, but I just want to say that this organization is great. It's great to be associated with you. I hope we can continue our relationship now, as we've started it with this gift of almost $3,500 from our Christmas offering, and we hope to continue to support you in some way in the future. So Kelly, take it away.
Oh, that was wonderful. Thank you, Gordy, very much. And thank you for your gift. That makes a huge difference. And like I said, I started last February, right before all this hit. So kind of my vision for this role as Director of Philanthropy has totally changed, like everyone else's lives. So I am newer, and I know there's so much history and so many wonderful people involved. So it's always fun to hear people's stories, like Gordy, of how long they've been in touch with GHM. So I'm going to do a quick little presentation kind of talking about global health generally. But in reality, what global health does is huge. We have so many countries, so many projects, so many things that we're doing. So I'm just going to talk a little bit about what we do, but it's pretty complex working with so many countries and partners on the ground. And I have to agree with Gordy that I've been really impressed with the integrity of the organization as I've come on board. That's really important to me, that funds are being used well, people are being supported, that we're not just throwing money around and not knowing where it's going and the people that are impacted by it. So it's been a really, really fun journey to join this team and kind of keep building on the work that Global Health has done. So again, my name is Kelly. It's Gaelic. My mom is an Irish citizen. And so, yes, it doesn't look like regular Kelly. It's a lifelong challenge, but any other Irish people, happy St. Patrick's Day coming up here. We'll be celebrating with putting pennies in my kids' shoes. They always love that. So it's kind of one of those. But I also would love this to be a dialogue, because if I was there in person, I would hope you'd raise your hand and ask a lot of questions. So just jump in, just say, hey, I have a question about that, because again, there's so much information. And we can also wait till the end to ask any questions too. And because there's just so much happening in the world in terms of global health. So jump in, ask questions. There's only a couple of us online here, so feel free to interrupt me. Otherwise, we can wait till the end. So again, thank you so much for having me. I'm going to share my screen here. And let's see if it works here. Okay. All right. So as you can probably guess, Global Health Ministries is about improving health. And over the years, maybe you heard when we started about 33 years ago, it was really built on missionaries who were working over in Tanzania and Kenya. There was a couple other places. They came together and they said, hey, we don't have any supplies. And over in America, they're just throwing things away. There's a surplus, or say something's expired but could still be used, or a perfectly good x-ray machine and it's just being recycled, versus we would love to have it. And so that's kind of where it was built. But over the last 30 years, it has really become about improving health as a whole. So not just giving supplies, but that we are all have the right to have a healthy life, and that not everyone has access to a healthy life. But we want it to be much more holistic. That means having clean water. That means having food. That means having access to healthcare when you need it. Also having resources. So it's kind of a much bigger picture than just sending supplies that it started with. And I think that that's where we kind of are different than others in the field. So like I said, we started with shipping, and we still do that. Every month, we send a huge big container out of our warehouse overseas to one of the 13, now almost 14. We're working with Chad on some partnership things in the last couple of months here. So shipping these huge containers to partners overseas. And sometimes those shipments take 3 months, sometimes they take 6 months, depending on where they're going. But that has really been the foundation of where we started, and then we've gone from there. If you've been to our warehouse, it's really a fun experience to see the amount of generosity of people who have donated supplies and then what happens to them. We haven't had as many volunteers lately just because of COVID. We can talk about that, but you're always welcome to come and help if you're in the area. Also, we then moved to doing some grassroots support. So this is really where we have learned that just having rural clinics and hospitals doesn't save lives. The actual difference, yes, it creates, in extreme situations, it's really important, but actually what really makes a huge holistic difference in communities is community-based healthcare. And that is training leaders within their own communities to recognize, this is malaria, this is malnutrition, this is when you should go to the doctor, this is how you wash your hands, this is how you, just those simple sanitation and other kinds of resources that are basic education. That is where we're seeing a huge improvement in the health of communities just with those things. So we support staff to go into these communities and educate, and that can also be including buying them a car. It can also look lots of different ways, but it's really gathering communities and teaching them about how to have healthy lives. And then we also, more recently, maybe in the last decade, we have provided leadership training. So that includes scholarships for nurses and doctors, but also for any kind of administrator in any of our partner countries that would like help with anything. Maybe it's even lab technicians, what's the best way to set up a lab? And we would connect them with someone here or in our other countries and share expertise. So that's been hugely valuable to lots of people in terms of cross education. Because a lot of the doctors overseas, they went there to be a missionary doctor, or they are a doctor in their local community, and then they're suddenly promoted to be a administrator of a small hospital, and they have no idea how to do that. So this kind of helps with that. So like I said, we work in 13 countries, and we are working with Chad, so it's up to 14, but that hasn't made it on this slide yet. So mostly in Africa, and like Gordy said, the CAR has been placed, and South Sudan for sure. So, and we could go into, if you ever have questions, of why we pick certain countries and work with certain partnerships. There's definitely reasons for that, and we could go into that if you're interested into that. All right, here's a short video about our warehouse that might give you a little bit taste, like Gordy was saying, about what happens in Minneapolis.
Hi, my name is Scott, and I want to share with you stories from Global Health Ministries and the impact of our shipping ministry. Much work is involved in these customized shipments. There's a lot of fingerprints. Truly a labor of love. We start with a good needs assessment from our partners overseas, identifying exactly what is needed most from our partners. Taking that list, we sit down with a companion synod, a congregation, interest groups, and we review those priorities, create a budget and a schedule, and review what are the total costs for this shipment, door to door, and what impact will it have for our partners. We then gather these items, bring them into our warehouse where volunteers sort them and box them and inventory them. And when we're ready, we gather them down in our loading area, and volunteers load each box at a time, building a solid wall in that container all the way back. It is a beautiful day. It's a day of celebration. And then we pray. We pray that these items will have an impact on our partners' ministries, that they will provide care for all in the name of Christ. And then we pray that the container will clear customs and is delivered directly to the door. It is a day of celebration. It is the arrival day of a container from Global Health Ministries.
All right, so that's a fun little video to just give you a snapshot of kind of the journey that our shipping ministry does. And I feel like that's really, I'm going to focus a little bit on that today, because that's really the best way that congregations can kind of get involved. And I don't know if Bethel has done any of our kind of at-home projects or group projects. So there's some, we have about 3 projects that a lot of churches and congregations participate in, and people can do it individually, or they get together like with their book club or quilting club or women's group or choir. And one of them is rolled bandages, and we have instructions on our website. And we need rolled bandages, and it's basically taking strips of sheets, and we have a little rolling machine. We have instructions if you want to make a rolling machine, or you can just roll them yourselves. And strips of sheets that are clean, you can buy them at a thrift store or new. Those are incredible for saving lives and making a difference with people. This picture is actually from a soccer accident in Liberia. And just the need for rolled bandages is huge, and something that you can just do at home. So I know, talking about the CAR that Gordy was talking about, it was actually, there was a gentleman who had broken his arm, and there was no medical facility available, and that person passed away. And that's really what spurred the church on back in the day of CAR, the local Lutheran church to start working with GHM, because they were saying our people are dying from ridiculous things. Like we need some resources like this. So another thing that congregations can do as well as part of the shipping ministry, we in every package we send rolled bandages, but we also send hospice kits. And so here's a volunteer wrapping up one in a group. I know we're not gathering like that, but people are doing it at home, gathering supplies and putting together these wonderful hospice kits. So not only do they go to people who are going to pass away, but also people who maybe just want to be encouraged and just to bring comfort. We give hospice kits to, there's a program at Cillian Hospital. There's an HIV/AIDS program for kids where they can come and be educated after school, get treatment, games, medications, mental and spiritual care, and they all get these little kits. And there's a fun story that I recently heard, actually. There was a 10-year-old girl who hadn't been speaking. She was diagnosed with AIDS. She had an HIV positive mother as well. And she received her hospice kit, and she hadn't been talking for years. And as soon as she got the towel, no, it's not this little girl, but she got the towel, she spoke for the first time saying, wow, this towel is the softest towel I've ever felt. And so obviously it was a combination of a lot of things, but these hospice kits actually make a huge difference for people feeling cared and loved. And so we put those in every shipment as well. Here's another little kid with rolled bandages there, just a little cutie. This is a slide to kind of talk about, this is an ambulance. So this is basically someone who had just brought a mother to a rural clinic. So this is what we're talking about when traveling in the communities we work in. So that brings me to the last kind of at-home thing that you can do as part of the shipping ministry is these newborn kits. So similar to the hospice kits, these newborn kits are for moms to come and receive, and it really does help with prenatal care. So moms know that they'll get these little kits, and so they'll actually show up early and collect the kits, and they can be checked out. And then also they can stay at the hospitals until they give birth, or then they can come back and get assisted delivery. But then it also helps them to then build relationships with the clinics and say, hey, you know, we're trustworthy, and then they can come back for well children visits as well. So they're really just a way to love on other people and also encourage, again, the education of health. So here's another little baby getting the baby kit. So I was going to focus on kind of one country here, one story. Like there are thousands and thousands of stories, and I'm still learning them all. And I'm sure some of you have some that you remember too. But we last year in 2020, we helped over 1 million people. So we're talking 1 million stories. So we're going to focus on one right now, and then kind of talk about COVID. This little girl, I'm probably not going to pronounce it right. Dejutu was her name, but I think that's right. I asked Doug. She was age 11, and you know, cooking with your mom shouldn't be dangerous, right? She was in a situation like this in a very rural community in Cameroon. She is actually Muslim, and she was cooking with her mother. I think it's called the Fluni Muslims, and they in Cameroon are a nomadic group. They follow their cattle. Here's another picture of that group of people. Go back to her picture here. So she was cooking with her mom, as we heard, and there was sparks from the fire, and she had kind of the spandex pants on, and one of the sparks had hit the spandex and started spreading in there. Now, they aren't taught to stop, drop, and roll like we are, and so she kind of just went running around flailing, and the fire started to spread on her legs. Now, the other moms and things came over and, you know, pat her with brush and things like that to get out the fire. But by then, from because it started on her thigh, 2/3 of her body was burned. So her mother, not being close to any kind of rural clinic or having the ability to pay for anything like that, just said, well, we'll be okay. So by the time she showed up at this hospital here, they waited 9 months until she was able to cut here. So of course the hospital took them, and through GHM we give a lot of money through our angel funds to cover, I don't like the name, but this is what they call them overseas. It's called Poor Fund. So basically that we pay all their medical bills. And she obviously had infections. She needed skin grafts. She needed medications. And she stayed there for several months being cured. And so none of this would have been possible without GHM. Every single piece, those rolled bandages, every kind of surgical, all the medication was all from GHM to help this little girl from healing. So here she is. I think it was maybe like 6 months later or something like that, where she is again learning to walk and has had again a bunch of surgeries. I think there was a gentleman named Jim Noss, who's in this picture down in the bottom there. There's a longtime missionary at CAR that maybe people there are familiar with. I'm not quite sure.
Jim lives in Farmington. He's a great guy.
Oh, good. You do know him. Yeah, that's awesome. Yeah.
Yeah.
So he went and visited her and saw her, and just her story of survival is really miraculous, and how that these things can they can get help that they need for sure. So she's a spark of joy there for sure. And then when I talked to Gordy about kind of talking about GHM, obviously COVID is on everyone's mind, and what's happening around the world, and every country and every community is different, especially in developing countries. And so what is GHM doing and responding? I'm happy to answer any question if you have specific questions. But I did pull up a couple of pictures, because we have so far sent over 250,000 PPE items to partners who have asked for it, for sure. We've continued to send masks and shoe covers and head shields, and so all of those things, as if they need them, then we're sending them in the containers or airlifting smaller packages if we're able to do that and it's able to get on the ground. The shipping process can be quite complicated with customs and all those things. So, but Scott, who you saw in the video, is great at all of that. He's our director of operations. So we also continue to offer soap, but also education is really the big piece that we're focusing on. The amount of misinformation, not only here in America, but as you can imagine overseas, it's tremendous. So we're really trying to mitigate the spread by education. And in this top picture here, you can see they're posting signs and giving signs of, staying 6 feet away. If you have a mask, to wear a mask, wash your hands, those kinds of things. And these are the symptoms to check for. So yeah, those are the big things we're doing. We're also giving and have given a bunch of small grants to get workshops going. So a lot of people have lost their jobs because of COVID shutdowns. But some countries are opening back up, but not all of them. And so we are paying for them to make masks and other things in country. So here's a little workshop that they put up to not only help with the PPE shortage, but also give people jobs, which if you don't have a job, it's hard to make healthy choices, for sure. And then here's one of the masks actually from a volunteer from over here. Maybe one of you made it, no, and was sent to the hospitals and with the babies and things like that. So we're doing a number of things, the PPE, offering grants, and a lot of education through our community workers on the ground. And that's making a big difference. There's, you might have, there's actually recently a New York Times article talking about, which I think it was last week maybe came out, or there's a lot of statistics out there that the numbers in Africa are really low compared to the US. We can talk about that more in depth, but I did also want to mention that there's a couple reasons maybe for why that is coming up, and some are maybe more obvious than others. obviously reporting. So not only clinics and hospitals reporting numbers, but also even just people who maybe don't have access to anyone reporting themselves, and then even access to testing. Testing can be very expensive. So possibly those numbers could be super inaccurate because of those two things. Also, the population, if we're talking about the whole continent of Africa, which is huge, right, is made up of a majority of youth. If you think of the average age in many African countries is 15, whereas that's not here. So, and we've learned that COVID isn't affecting younger people as much. So that could also be a reason why. Also, I think a resiliency to other viruses. They've been exposed to a lot more things. And so possibly their immunity is different in terms of if there's been other coronaviruses, Ebola, other things like that could play into it. Again, there's so much research still being done and we don't know. Sometimes people are like, well, what? Maybe they don't even need it. The numbers look really low over there. They definitely need PPE and help. And at some point, vaccine, we can talk about that. I also think that the response that a lot of African countries took right off the bat, because they have seen pandemics before, that they shut down things immediately. And so there was just a different response here, which could mitigate the spread for sure. And also settings, most people live outside, right? Most people work and live outdoors and just sleep inside. So that could also have a big effect on numbers for COVID. Those are just some conversations that I've had with others that were interested in kind of hearing why the difference of things. But yeah, I think the best thing that global health has to offer the world in this space is our partners. So we have over 30 years with many of these partners of trust and knowing. So when you say like, say there is a vaccine available and UNICEF or one of the other big companies say, hey, we're going to roll out vaccine, who administers those, right? That would be our partners. Who gives out malaria medication and who do they trust? And that's the big, huge piece, that these people live there. They're not coming from the outside. These are their people, local people on the ground. These are not me or Doug or anyone coming in and saying, hey, you should take this vaccine. This is really where the trust lies and where the care ministry lies, where they can come and hear about Jesus when they come to these clinics or come to education hours in their own communities and love there. So I think that makes a huge difference, because that was kind of what I was wondering. Well, there's tons of people doing healthcare overseas. What makes GHM different? It really is the partnership with the local churches that have built trust with their people in order to really spread love and education about healthcare. So we can talk about that too. I know, like in Nigeria specifically, when COVID hit, the government put out a huge big marketing plan basically over TV and radio and flyers, and said, this is what COVID is, this is what you need to do. And many of our partners reported that their community health workers that go into these very rural villages hadn't heard any of that. So it was the global health partners that were really coming in and educating for the very first time, even though the government had done this big, huge campaign. So it's these boots on the ground, super grassroots, that is making a difference in 1 million people's lives. So that was a lot of information. And so I would love to take any questions or talk about any aspect of either the shipping ministry or the grassroots ministry or COVID. They're so all intertwined as well. One supports the other. And when we talk about COVID, what are we doing specifically? I mean, it's affected everything, right? It's in every single thing we do. So it's not necessarily this separate little campaign over here, yes, for PPE, but it's going to forever change everyone in global health.
So Kelly, there's a question on
yes. Let me stop
on the chat. What is your focus in Central America?
Gotcha.
And if anyone else wants to use the chat to ask your questions.
Yeah, sorry, did you see that? So in Central America, that is actually where Gordy mentioned Tim Iverson, who was the past executive director before the current one. And he had a real heart for Central America. And they are primarily all focused on the community-based primary health care. I know that's a lot of words, but that's essentially working with the local churches to educate the population on good health practices. And time again, there's a million pieces of evidence that that is actually where community change happens. And so we have, I think we have over like 150 villages and towns in El Salvador that we staff community health workers to go in and educate and do kind of like what we're doing now, right? They would have a Sunday morning education hour for adults and children on proper hand washing, proper, whatever the topic of the day is. Obviously, COVID has been huge too, but that's really where we're going to start to move towards. Obviously, people need supplies. People need, stitches. People need x-rays. People need those things in a lot of measures. And when we can, we do purchase in country. So I do want to say that, like, if something is cheaper in country, we would rather support those jobs, resources within the country versus sending from America. But we do get donated around $3 million worth of in-kind donations from local businesses here in Minnesota. That is anything from super high technology to, like I said, rolled bandages, right? But with every kind of new piece of technology, we really have a very strict guideline in terms of, do they have the power to do something? Do they have the know-how? Do they have people that can update it and keep it going? You know, we don't want to just give, hey, here's an x-ray machine, and they don't have anyone to work it, anyone to fix it, you know, then that isn't useful. So there is quite a bit of criteria for the high-tech items, but some of our hospitals can withstand that, and it's a miracle. So there's a couple other questions I can answer here. So how do you get started in a new area? So that would be a good question, and I would probably, if there was a real serious conversation for a certain country, I would connect you with other staff than myself. But essentially, there needs to be people on the ground. You know, we've primarily started with Lutheran church based. We work with the, Lutheran Church of Tanzania and the Lutheran Church of Madagascar. So churches on the ground that are willing and able to continue this work, that it's not on us coming in. So if there is a great need and there is a way to work together, we're happy to do it. It means that there needs to be a lot of people there that want this to happen. But we also do a lot of ecumenical work, I think, kind of like what Gordy said. We will do a shipment, and if there's a Catholic hospital next to the Lutheran hospital, we'll give them things as well, or a Muslim hospital. We are not saying only Lutherans. It's really about, if this community need is there, then we will send it. Although we primarily work through Lutheran channels for sure to see what the need is. We never send anything unless they ask for it. I think that was in that little video that Scott put together. They look through our inventory list, say what they need. So it's never us just sending what we think they need. So it's really about them. How do you prioritize scarce resources? Whoever sent that, can you elaborate a little bit on that? What do you mean? Like, if we only have so many PPE, who do we send it to first, kind of thing? Or maybe you can elaborate a little bit on that. These are great questions, for sure. Anyone else have a question? Oh, monetary resources. Okay. Well, it depends on, so a country, a clinic, a church organization like in El Salvador can sort of ask for a grant, and they can submit a proposal and say, this is what we're thinking. We would like to do famine relief in conjunction with health education, in conjunction with sustainable farming practices so that there isn't starvation in this. And we think it's going to cost $200,000. Can GHM help? Right? So in a big number like that, it would be our board that would decide that in terms of how much we could do. But it depends on them requesting money from us. So it's not necessarily like if there's a lot of requests, then it would be up to the board of directors to decide how to disperse the funds that we have available. Or they come to Kelly and they say, hey, Kelly, we need 50 grand for this one project, this water project in Madagascar. Can you go raise it? And then I will do that and then hopefully meet the need of everyone. So, you know, I wish we had millions and millions and millions, but we do have to prioritize or say, hey, we can do 10,000 for this project. Or we have a donor that came through and said, I really care about Celine Hospital and their NICU, and I want to donate $10,000 to them specifically. And it's amazing how God works in those situations where a hospital will say, hey, we need a new computer system. And then Scott, our director of operations, will get a call from some local business in Minnesota and say, hey, we got these computers. Is this something you would take? And he'd be like, oh my gosh, we just had a call. This stuff happens all the time. And it's really fun to be in God's work in that way, for sure. To see the need and how he shows up. It's really cool. Good questions. Anybody else?
I think I'll just add that one really good thing about how GHM works is that they don't impose things on people. They really develop partnerships where the recipients are the ones who make the decisions and do the asking. And I think in the past it has been the goal of some missionaries to impose our own thoughts, our own ways of doing things on the population, but not so with GHM. We've had experience where they've hauled things abroad for us. I think we got 50 computers sent to India on one of your containers at one time, along with gobs of quilts that were given to the people in India that we work with, as well as a bell, a big church bell that went
cool. I hadn't heard that.
To the Central African Republic. So they've sent more than just medical supplies. If there's room, we can deal with them. They will send other things. We've really appreciated that collaboration as well. Yeah. One other thing that just so that we can make this clear is that these organizations, there are many local organizations, global organizations, immigration organizations. These organizations act as the arms and hands of our individual congregations. We can't do this ourselves. We can't go into another country and start a program as a congregation, but we depend on such organizations as Global Health Ministries to do that work. And we can support them, but in essence, they are our arms and hands and hearts reaching out to the whole world. And so the more we can spread out and support these kinds of organizations that are really doing a good job and that use money wisely, the more our ministry expands. And when I think about Bethel's ministry and all the things we support now and all the things we will support in the future, this is the ministry of the church. It isn't just in our own building, but it's well beyond that. And all of these organizations are so important to expand that ministry. And I think we also owe it to our congregations to educate everyone on what we're doing and what these organizations do for us and with us.
Oh, thank you, Gordy. Yeah, so true. I think there's just so much you can do as an independent congregation, right? And so we're just one facet of the church that's doing work. And we're just really proud to be that one arm, that one foot that
And
helps.
there's a huge Lutheran network, not just the ELCA, but lots of Lutheran organizations that are doing good work around. So there's plenty of networks within our own denomination to keep us busy. That's for sure.
Yeah, no, that's a great point. Yeah. Anyone else have a question? I don't want to take. Yes.
A question. This is working from the other end. My husband and I used to be medical volunteers in Haiti.
Oh, awesome.
And I worked in the warehouse. And it is so good to hear that the people at that end request stuff, because I was dealing in the warehouse with stuff that was, not needed, not apropos to a country, and people send things. But even, and it has been 25 years now since we worked in Haiti, but we were using those rolled bandages all the time, those sheet bandages. And they were, just as you said, for people with burns and dressings that had to be changed all the time.
Yeah. Yeah. Oh, well, thank you for doing that work. And yeah, that's awesome. Yeah.
We put in 2 years of work. Pardon?
Kelly, on a personal level, tell us a little bit about how and why you came to this position with Global Health Ministries.
Yeah, that's a great question. So I have always worked in nonprofits for the last 20 years, have a master's in nonprofit administration. And I started my own nonprofit actually about 6 years ago. I had always done a lot of work overseas, and through a nonprofit, it's called Print the Love. It's just a passion project of mine. We're all volunteers. We give away photos to people that don't have access to photos. So people that literally have never had a photo of themselves. And I had done a lot of work over in Africa prior to this and saw this need that we would take a lot of pictures and we would never give them, and how disheartening that was to me, because I'm going to take this picture home of this really cute kid and he doesn't get it, and so I started asking questions like, why, do you have access to photos? Well, of course they don't. So I started this organization, and through that, I started to go to every continent and take and give pictures. We really have a strict policy that we don't take pictures because it's really about them and celebrating them. And the amount of joy that is created from giving someone a picture of their grandma, of their family, of their brother, their sister is incredible. But that is where I first was able to get inside of hospitals, because we would go to maternity wards and give away photos to the new moms that would never have something like that. But also the hospice wards and the children's wards. The people that were passing away, they really wanted a picture to give so their family wouldn't forget them. But also children's wards love to be cheered up and things like that. And so obviously when you are there, and anyone that's traveled or been a part of any kind of medical mission work or mission hospital, obviously that wasn't what I was doing. I was giving away photos, but saw that there was a need, obviously. And so when this job popped up, it said, oh my goodness, I really saw, I saw, as terrible as it sounds, we went to a lot of government hospitals, and I saw people dying on the side of the hallway because they just didn't have time or resources to help them. So those kinds of things are really profound and move you into work like this, and say, hey, where can I fit in? I can't move overseas, although that would be really fun. I do have 2 little kids that live here in Minnesota, so we can't move yet. But what can I do on this end of things to tell the stories? And like Gordy said, it is really important to me that there isn't this white savior complex. I don't know if you've heard of that, but it's a good area of study. That it isn't about what I want them to have, it's about what they would like to have, and that they're just under-resourced. They know what they need, they're super creative and resourceful. This isn't about what I think, but that they request and are working in their communities, and that GHM can be there. You honestly, if you went to a lot of the hospitals that we work in, a lot of them don't even know GHM, because we try to really stay behind the scenes. Doug, our executive director, is always like, we don't even want to be seen. We want to be behind the curtain saying, what do you need? We're here for you. This isn't about Global Health's name, or don't, because people are like, oh, we want to put your name on the building or name the hospital after you. No, we don't want any of that. We just want to uplift you and your needs in the health space. And for me, health is really important. There's been health challenges in my own life, but also mental health, spiritual health, all those aspects of a holistic, healthy life, that it's not just one area, was really important to me too. So that was a long answer to your question, but hopefully that makes sense. But also, I know GHM, if as a congregation you want to participate in any of those projects, but also if any of you are going, we have a Suitcase Ministry. I wanted to mention that too, where we'll give you a suitcase that you can leave there full of medical supplies for a clinic or group of people if they're going full of rolled bandages and other supplies that they may need, or that you talk to someone over there that they would request. So that's a fun way to get involved as well if you're traveling, not probably anytime soon, but even in the next 5 years or so, going to Ecuador or Tanzania or somewhere with other reasons to go. That would be a great way.
Are there any other questions? There's
Yeah,
Oh,
I have a question here, Gordy.
okay.
Once we get to a better place of safety, I don't know how safe your volunteers who come in and do the packing, how safe it is for them in there, what protocols you have, but would a group of us, for instance, be able to come up and volunteer for a packing day? Do you do that?
Yes, for sure. Yeah, great question. So we have had groups in slowly but surely. We do have a lot of practices in place. Obviously, mask wearing. Our warehouse is fairly large, although we have so much that we would need bigger, but we have stations that are separate from each other. So you can each do different stations, different things that are separate. We also have groups that can take boxes for sorting. That's a big thing, is like a lot of the hospitals will drop off and say, here's all the last stuff from the month that we didn't need. And then we have to sort it and inventory it. So even just help sorting it, people will take those home. I know it's a little bit of a drive for you guys, but more volunteers will do home projects too. But we're starting to take groups. We have a lot of precautions. Our warehouse manager would know all those things. But yeah, typically like in the summers, we have youth groups every day and women's groups every day. And yeah, so this has been a really weird time. But yes, you're welcome to come anytime. And even if it's soon, if you have a group of vaccinated folks that want to come or not, I just connect you with the warehouse manager and he would tell you all the kind of rules and protocols that we've put into place. So
We're going to have to close up shortly, but somebody did ask what is contained in a hospice kit.
Oh, good question.
Yes, that's what I wanted.
Oh, is that the question?
Yeah.
I am going to send you a link with everything. I'm pretty sure there's soap, towel, toothbrush. There's a whole thing. That's a good question. Let me look that up quick while you're finishing the talk.
I'm sure you can find that on their website too. And I just want to stress that you can get a lot more information about GHM on their website, which is just simply ghm.org, right?
Yep, super easy. Yep.
Yeah, so Global Health Ministries, ghm.org. So those of you who are interested, and the rolling bandages, hospice kits, there are some projects that can be done within our church if someone is interested in getting something going in those areas.
Yep, it's right. So here there is right on our website. You could look under service projects, and under hospice kits gives you all the instructions of what to do. But it's a bath towel, washcloth, bar of soap, toothbrush, comb, nail clipper, band-aids, petroleum jelly. That's more for like sores and things. So if they need to be moved about, gloves, and then you bundle everything in the towel and secure it with some twine and ribbon. And so that's kind of what's in there. And then, yeah, groups will put a bunch of those together, or you can even just make one and drop us off, drop it off. We have so many partners that ask for these things in every shipment. And we can only send so many because there's only so much room on a container. Yeah.
So I thank you, Kelly, for coming, spending this time with us. Thank you all for joining us with this discussion. You did a great job, and I hope we can continue the support of Global Health Ministries.
Yes, thank you for having me. It was great, and definitely follow up with other questions if you have, or yeah, any other questions for sure. Gordon can maybe send my email, or you just find us all on our website. So.
Okay.
Sounds good. Well, have a good day. I think it's going to be another beautiful day, so let's hope.
Thank you so much.
Okay, bye everybody.
Oh, bye.